In this tutorial, we're going to go over two different approaches to injecting the shoulder. This is a 72-year-old female with significant osteoarthritis in her right shoulder. She has a very large effusion that you can see. We're first going to go through a long axis approach where the needle is parallel underneath the probe and you can hopefully get a good view of the whole needle during the procedure. And then we're going to go through a short axis approach where you can only see the tissue move and not the actual needle. So we're going to do our right side. So here where we're pushing on the skin with the needle cap, and you can see this very large effusion in the posterior recess, a very flattened humeral head consistent with her significant osteoarthritis. The effusion makes it somewhat of an easy target. It's got a steep drop in that humeral head, it kind of makes it a little bit easier. The fact that she has such a flat humeral head, you can probably go in at a steeper angle and you don't have to worry as much about hitting the articular surface of the humeral head. Here we started off initially too shallow, and if we kept going we would overshoot medial to the joint. So we have to readjust our needle and angle it in a more vertical orientation, and here we are heading towards the actual posterior recess that is full of fluid. You don't get a great view of the needle due to the steepness of the angle, but again you can see the tissue move through jiggling the needle, and that's so you can get a good sense of where the needle is. In this case we only used a 1.5 inch needle since she was quite small, and I was pretty confident I was able to reach the joint. However, that resulted in a steeper angle of the approach. Here's that first flash which confirms that you're in the joint. The flash is essentially some air that was in the needle shaft that was initially part of the injection. And in fact, that air can actually help you just pinpoint where the needle tip is, but too much air will kind of cloud your whole picture. And then we'll just continue with the injection and filling up that posterior recess with the viscose supplementation. And here you can see more of that viscose supplementation fill up the posterior recess of the shoulder, and she actually did respond well to these injections. So that was our long axis approach, and now we're going to go ahead and I believe a week later we did the same injection, just short access to the needle, where essentially you're just